Good afternoon, everyone. Good afternoon, moderators. Thank you, Susanna, for the delicate presentation. I would like to, to do observation that although here in Brazil, I'm used to give lectures, they are almost of the time in Portuguese. So my English is often used to listen and to read. And sorry if some words don't sound so perfect, okay? The subject of my work is the use of chlorhexidine plus C2-peridinium chloride in Alpantha, our beloved king complex, in the postoperative control of gingivoplasty. This patient came to us here in our clinic with the complaint of showing too much gum when smiling, even though she had already undergone a surgical procedure a few years ago to try to correct this same problem. We can see in these images that the patient did not smile because she was ashamed of showing her gums a lot. Here in Brazil, we have a expression is sorriso amarelo, is yellow smile. I can translate this to English like a fake smile, restrained smile, because of the shame to show a lot of gingiva. This picture has a story. Only after 3 attempts of the photographing did I get a full smile from her, a complete smile. Almost of the time she give me that half smile, the yellow one, like I said. In the clinical evaluation, it was possible to observe the excess of gingival exposure and also a high volume of exposed gum. Here, in an intraoral view, the horizontal gingival and bone volume is quite evident. A tomography with soft tissue removal was requested for the patient so that we could assess the volume and position of this gingival margin in the exam. A probing was performed. The protocol here, it was always to do this probing before any procedure. A probing was performed to determine the gingival phenotype and sulcus depth. Sometimes, depending on this phenotype, we can just indicate the surgery, not liberating the patient for the surgery. The sounding was compatible with what was visualized in the tomographic exam. Here we can see the end of the enamel and the gum covering this end of the enamel. The patient had at least 1 millimeter of gum covering her teeth, in some places a little more. Some sounding places even showed 2 to 3 millimeters of depth, demonstrating that the indication for the surgery. In this image, the excess of horizontal volume at some points was clear, like we can see here and here this excess of horizontal volume. I open a parenthesis here to talk quickly about this horizontal volume. Sometimes we see gingivoplasty surgeries that are apparently not successful, the patient not happy with the result of the surgery. Because sometimes even with a high quantity removal of soft and bone tissues, but without the removal of this volume, the perception of the relationship between teeth and gums is not good, which gives the impression of still a lot of gingiva. The patient shows, we remove the gingiva and the perception it's a lot of gingiva because this relationship. The patient shows more red than white, and this gives the impression to someone who's looking that excess of gingiva. Here, the first moment of gingival removal, showing the difference we would have in the smile, and here at the end of the surgery. In this slide, we can see the real importance of using chlorhexidine to control plaque. Although the patient was instructed not to use the tough brush only in the first operative week, as she reported, she ended up fearing to use to brush her teeth, and finally not brushing properly for almost 12 days. We can see here in the lower jaw a lot of plaque. This is the reason the King complex, the chlorhexidine, was very important to maintain the gingival health in the post-operative periods. And sometimes I can say a little of factor of success. The surgery was the control of the plaque. Here the result after 3 months. Here we can see a full smile in the first try of photographing in her. So it's clear that she was very happy with the result. The before and after, showing the change in the patient's smile, a clear change in the smile. Remember that this second picture was taken after 3 months of the surgery. Here, in a closer view, we can see that we achieved a great exposure of teeth. Some places like here and here, almost 2 millimeters of enamel gain, enamel showing, teeth showing. And the final picture, after bleaching and correction of some small enamel defects, she had some defects like here and here, and after the surgery, the gingiva was not the problem, but these defects. And after the bleaching and the correction of these small enamel defects with composite resins, and again a happy smile. Okay. Thank you all.
Okay, so we'll start moderating, or commenting. Anna?
Hi, everyone. I'm really enjoying this late afternoon that we are having here. So I want to thank you, Kin, for this Carmen, Susanna, Mar, Sasha, all of you, for this marvelous initiative that we have in these awards. Thanks for my invitation. I'm really glad to make part of this jury with my colleagues. And I really want to congratulate all of the participants, because we had a lot of clinical cases and a lot of clinical with great and scientific quality. So, muchas gracias, Kim, por esta iniciativa. Estoy muy contenta por tu invitación. Felicidades a todos los candidatos, porque juro que algunos no lo hablan muy bien en inglés. Entonces estoy haciendo eso en castellano, pero estoy muy contenta de hacer parte de este jurado, y todos vemos muchos casos clínicos de gran calidad, hasta todo el mundo, de gran calidad clínica y científica. Rodrigo, thank you for your clinical case. I really liked that smile in the end of all. I have 2 questions of you. One of them you had already answered me, because I was going to ask if you have done a tomography pre-operative, and you did it. So I'm glad you did it, and I am glad you studied the clinical case all over. And I hope next time you will put that slices of tomography on that clinical case for us. Just let us know before that you did it. And I want you to answer me a question. Why did you think that it have been a recurrence of the previous treatment that she had done?
Thank you for your words. investigating the story of the previous surgery, she told me that no bone removal at all. The first surgery was made with electric scalpel, okay, and no bone removal. Looking at the tomography, we have the tomography like a normal procedure before this kind of surgery here, and looking at the tomography, we saw that no bone removal at all, and recurrence of the gingiva. She told me this. The first surgery was made in the how can I say, in a fast way. It's like a 30-minute surgery, okay? Just removing the gingiva, and after 3 months, 4 months, the recurrence.
Okay. Do you consider doing a surgical guide for this surgery? Did you consider that?
Yeah, I like a surgical guide, but I like to use to me, one problem of these guides was when I use the blade, it starts to stop on the surgical, and sometimes I have not a perfect cut, and this cut is sometimes I can get the change of the position that I want in the gingiva, and so I don't like the guide.
Okay, thank you. Thanks for the final results. The best one, it will be the patient smiles, of course. Olivier, tell us. Hello.
Thank you, Rodrigo. Thank you, and congratulations for your beautiful case. It was a pleasure listening to you and seeing this case. The gingival smile, very, very challenging clinical situation, because very, very often they are linked to many different etiological factors. You address the one which is with the excess of gum. I just have a question. When looking at your initial picture, when the patient smiled, displaying this gummy smile, I think that we could obviously see some very, very obvious nasogenian fold also there. Is this kind of information important for you for the kind of procedure that you will need to perform to solve the problem? Because I think that very, very often the hyperactivity of the lip is very often an issue, and very often patients displaying this kind of excessive pool of the lip very often also display quite a big concavity on the apical portion of the maxilla. Is it something that you, when you raised your flap and did the osteotomy, the bone recontouring, is it something that you could observe?
Sometimes this we have two ways to determine the surgery. When I open up the flap, I remove a little bit of bone, okay, but I how can I say, I don't move the muscles to give me a reference of how much bone to remove, just to see this position, okay. Sometimes when the muscles are over acting, I used to do a second surgery, like lip repositioning, okay. When you have these muscles acting like you said. In this case, without lip repositioning, just with the removal of gingiva, we have these results. So I didn't see anything that would think about lip repositioning or thinking about the muscles.
Okay, great. Well, how long time? I mean, the follow-up period that you have. How many months do you have after the surgery?
About until the pictures, 3 months. Now I have 1 year of the looking the patients. She's a sister of a friend, so I see almost a week, and until now it's a full smile, not a fake one.
Yes, yes.
About
I
a
think that's the
year.
kind of treatment which give lots of confidence to the patient. They can smile
Yeah.
without hiding. Yeah. That's a life-changing treatment. Thank you, Rodrigo. Thank you so much.
Thank you.
Okay, is there any other questions, or I will move forward to the next case?
Well, I just have one question. Because you gave me the opportunity, we talked about the approach for the gingivectomy, and I understood that you use the blade, right?
Yes.
Yes. Have you tried any other tools? I mean, laser or electrosurgery?
When Anna asked me about the guide, when we use laser, I love the guide, okay? But laser is not a easy tool to use in the daily routine clinic. And I like the blade. The electric scalpel, okay? I don't like the electric scalpel because I can't control how much of the gingiva we will lose. I don't like the heat of the electric one. I don't like I cannot control the electric one. And laser, unfortunately, is so expensive. It's hard to use on the normal clinic.
Okay. Yeah. Perfect. Thank you.
Olá, eu sou o Dr. Rodrigo Valter, um dos ganhadores do Kim International Awards. Eu decidi participar do Kim International Awards, pois tenho o Pharmaquim como um grande parceiro clínico e utilizo os produtos com excelentes resultados. O caso que eu escolhi apresentar melhorou muito a estética e a autoestima da paciente com uma técnica relativamente simples, que foi a gingivoplastia. A experiência final foi enriquecedora, pois pude apresentar o meu caso e aprender com a apresentação dos outros participantes. Eu agradeço a Pharmaquim pela participação e parceria. Um abraço.